Welcome to this LEX18 Digital Conversation. I'm Davidson. Is there someone in your life dealing with addiction? There is help out there, and we want to welcome Jessica Tate. She's the Director of Outpatient Services at Landmark Recovery. Welcome.
Yeah. Thank you so much.
This seems to be a story that we are doing more and more and more and more on. Let's talk a little bit about Landmark.
Okay.
What it is that you guys do and offer, and how this is kind of helping people who find themselves in the spiral of addiction.
Okay, I'd love to talk about Landmark. It's one of my favorite topics.
Yes.
So Landmark Recovery is a substance use treatment facility. So we actually opened our first facility in 2016, and that's an inpatient facility in Louisville.
Okay.
Currently, we operate a 36-bed detox residential facility, and so average length of stay for a patient there is going to be 30 to 45 days based on need, medical necessity, and things such as that. We offer an outpatient level of care in Louisville as well, so a partial hospitalization level of care where patients can come 5 days a week, essentially day treatment, and then also an IOP program in Louisville.
What's IOP? Inpatient?
An intensive outpatient. So our patients are going to be coming 3 days a week, 3 hours per day with that program.
Now, is this something that a doctor would have to refer, or can family members, or is this a self-placement?
All of the above.
Oh, really?
All of the above.
Okay.
We have doctors refer patients to us. We have therapists refer patients to us. We have families say, hey, I just need to know what you guys are doing because this is what's going on with my family member and how can you help? And then we have patients who just, hey, I've had enough and I want to do something different, and they self-refer.
Well, now sometimes people, you know, the first way to getting yourself corrected is admitting that you have a problem. Sometimes people won't do that. So is there anything that a parent or a loved one can do to say, hey, this person, I'm worried to death about them? Can they send them to you for a certain period of time for evaluation, or is that just not allowed?
You know, I always encourage, if you think that somebody could benefit from our services, especially in our Lexington office, call us, have them set up a meeting with us. They don't have to commit to coming to treatment. Like, just come in, talk to me. And if they don't want to do it with their family members around, that's okay too. If the family member can come, but the person that they're concerned about isn't willing to come, that's okay too. We're willing to meet the patient, the families, every single person where they're at. They can come in and tour the facility, and we can just sit down and talk and make them feel a little bit welcome and warm.
But it's not just substance abuse. There are other conditions that you address as well. Let's talk a little bit about some of those.
Absolutely. So one thing that's really neat about our program is that it is designed to treat co-occurring disorders. It is very, very seldom that somebody solely experiences a substance use disorder. So I drink and I only drink. It's not
just the drinking.
It's not just
There's
the
so
drinking.
many different layers, isn't it?
There is, and so our program aims to treat co-occurring disorders. So even if it's just like an adjustment disorder or a stage of life change or depressive symptoms, you have a lot of different mood disorders. And then specifically our program utilizes a trauma-focused curriculum because a lot of our patients either experience trauma early in their lifetime, and that's kind of what helps lead to developing an addiction, or they experience a trauma as a result of their addiction. So my best friend overdosed, my loved one left me because of it, and so there's these traumatic experiences that also happen because of our addiction. And oftentimes it's both. Oftentimes it's not just one or the other. And so our program is designed to be able to treat that and really give our patients the best opportunity for success and recovery.
Mental health and substance abuse, such a misunderstood area and so stigmatized. How do you think we can raise awareness, or you know, because, you know, sadly we see, you know, megastars like Robin Williams, and we lose somebody like that, and then all of a sudden we get this wave of people talking about it, but then it goes away. How do we keep the conversation going?
You know, I think one of the most important things that we can do is to normalize mental illness and substance use, because it doesn't discriminate and it's way more common. I can go into a room full of people and ask, how many of you know somebody who suffers or experiences a mental illness, and how many of you know somebody who uses substances and it's impacted their life greatly? I've done it before, and I've never walked out of that room without a hand in the air. Because
quite frankly, everybody has stressors in life. It's just, I guess, how we cope or deal with it that keeps us from tipping over the edge.
Right, right. And so I think that the most important thing that we can do is normalize it and keep talking about it and keep having these conversations.
Exactly, and embracing and loving the people through
Absolutely.
their recovery. Let's talk a little bit too about the opioid addiction and crisis, because it's at crisis state, isn't it?
Absolutely.
Our president talked about it last night, and from the Oval Office. What is going on? Where are people getting this from? How can we stop it? What is the trigger? What do you think is sort of the thing that's driving people towards those? Is it because they were given them legally, if you will, through medical treatments, and then something goes awry, or is it illegally? Which one?
Both.
Both.
It's both. And the opioid crisis is exactly that. It is a crisis. In 2017 alone, we had 70,000 overdose deaths because of opiates alone.
Right.
And that hits really close to home for Kentucky. We lead the nation. We are 5th in the nation in terms of overdose deaths. I wish I were.
Is it because people have easy access to it? What is it?
It's common. It's opiates. I get started on it because I had a root canal and my dentist put me on it. I have long-term pain management. I found these pills in my grandma's cabinet and I tried it, and it hooks us from the very first time. And that's what you have your patients tell us, is that the euphoria that is associated, like, it's a feeling that can't be replaced.
That's right.
And so it reinforces that continued use.
What type of interventions do you do to help people break the cycle, because it's something they will have to battle the rest of their lives?
We try to educate, and one of the goals for Landmark Recovery is that we want to help our patients create a lifestyle that is permanently free from all mood-altering substances, and figuring out that recovery does happen. We do recover, and we do heal.
Yes.
And so that's one of the things that we want to help our patients do. And so with our program, and here in Lexington too, our outpatient program, we help develop those life skills, and we bring everybody in. So it's not just our patients. We have the opportunity for their families to come in too, because we recognize that addiction is not just a me thing. It's not just a you thing, but it's an us
Everybody,
thing.
yes.
It's a systemic thing. And so it's not just the person who experiences the addiction that has to heal, but it's the entire family unit that has to heal in recovery.
Sometimes it's excising that person away from groups of individuals that maybe keep them in that particular cycle as well.
Absolutely, and so boundary setting.
Exactly. We hear a lot about Narcan, when we do stories about this, and a person was resuscitated using Narcan. Is this something that a family that's dealing with this should have, like an EpiPen for somebody who has an allergy, an allergic reaction? Is this a medicine that needs to be held in the home just in case?
Absolutely. Absolutely. If you have somebody in your life who is using opiates, or that you even suspect is using opiates, having Narcan available can save their life.
But it's something you administer, but you still got to get them to the hospital.
Right, absolutely. So Narcan is one of those things that is highly effective, but it's highly effective for 30 to 45 minutes. And then after that, the full force of the opiates can come back. And so it's when you're trained and you're told how to use it, you're supposed to administer Narcan, call 911, and get them to treatment.
Okay. But people are afraid, okay? CPR, sometimes people are afraid to administer that, because they don't want to get sued, or they don't want this, or they don't want that. Where's the training for it? Where is there a certification process for it? What's out there to kind of protect the public from the legal side of administering?
So I do believe Kentucky is one of the states that has the Good Samaritan law.
Yes.
So with that, it helps protect those Good Samaritans that are doing exactly what we need them to do, who are administering Narcan, who are performing CPR, and are calling the police so that they don't have legal repercussions.
All right. How do you find yourself getting into the business of helping people? Do you find that this was just a calling that you had? Because you told me you were very passionate about Landmark.
Yeah, I am very passionate about Landmark. I'm very passionate about what we do. I got into this at a very young age in terms of becoming a professional in therapy and treatment, and I came into it knowing exactly I wanted to work with addiction, because there's such a need.
But it's tough on you as a caregiver or care provider. That's tough.
It can be, but it's also very rewarding and very gratifying. There is no greater feeling than having somebody come in on the worst day of their life, because that's usually when people come to us. It's the worst day of their life. I have no other option. You're my last option. Right. And to see the progress that somebody can make, and to see the initial picture that's been taken on day one and where they are after 4 to 5 months, it is Oh, it's such a gratifying process. So as difficult as some days can be and as challenging as some days can be, it's worth it.
Yeah, yeah, indeed. Just seeing people find themselves, their true selves again.
I couldn't see myself doing anything else.
Yeah, yeah. It's costly though, isn't it?
In terms of treatment?
Well, the finance part. This could be a costly treatment. Is it covered by insurance? Are there ways to get some type of assistance through Landmark if a family is saying, oh my gosh, I want this for my family member, but I can't afford it?
Mm-hmm. So we are covered by insurances.
Yay.
You know, this goes to the age-old debate, is disease an addiction, or is addiction a disease, or is addiction a choice? We recognize it as a disease. Insurance companies recognize it as a disease. It is classified as a disease, and because of that, health insurance companies cover it.
That makes you mad too, doesn't it, when you hear people say choice over disease?
You know, I try not to let my feelings get too tied up into it, but I think one of the most important things that we can do is educate, because when we're talking about our patients and their families, oftentimes that's what you hear. They tell me it's a choice, and if I could just make better choices and decisions, but unfortunately that's not the case. It is a disease, and it is something that, if left untreated, is chronic and progressive, and it does get worse.
Wow. But the one takeaway that we want from this conversation is that there's hope.
Absolutely.
We cease to live when we don't have hope, right?
Absolutely, and a little bit of hope can carry us a really long way.
Oh, it sure can, it sure can. 24 hours, 7 days a week, people can reach you?
Absolutely. You know, you can call our admissions line. You can go to our landmarkrecovery.com and chat with our admissions consultants, and we will get you the help that you need.
Sounds good. And we'll also have the online information on our Facebook page and other social media as well. Thank you. It's so nice to meet you.
It's so nice to meet you.
And it's so good to have you along as always. Thanks so much for watching this LEX18 Digital Conversation. For more digital conversations, just log on to lex18.com. Until next time, I'm Davidson.